Since the COVID-19 pandemic started in 2020, contact tracing and limiting individual movement have been the most effective tools China has used to contain outbreaks. At the center of these two methods are the health QR codes and journey cards. But how exactly does the system work? The health QR codes generally feature three color schemes: green, yellow, red, which provide a clear visual representation of someone's health status. As COVID-19 evolves in China, so too do the health codes. When they were first introduced in February 2020, it featured just one single code. The latest version of the health code features not only the QR code itself, but also the user's last PCR result. A green code means no known exposure to the coronavirus and a negative PCR test result. A yellow code means a person has either just been discharged from a COVID-19 hospital or has not been tested for the disease in more than a week. Some cities will also issue a yellow code to a person whose mobile phone was connected to the same cell tower as the infected. Officials coined the term company of time and space for this situation. A red code means a person is either infected, came into close contact with an infected person, or just arrived from overseas and has not finished the mandatory quarantine. These days, anyone entering shopping malls, public parks, and restaurants must scan a venue code to record their movements and make contact tracing easier. This is the standard procedure of entering a shop in Shanghai. I have to present this code to a digital sentry over there. It will scan this health code, and once it all checks out, I can enter the supermarket behind me. But a person's vaccination status will not affect the colors of the code. To enter a hospital, a negative PCR result within 48 hours is required. Both yellow and red codes will severely limit an individual's freedom of movement. It means no public transport, no entry into shops, and the person is likely to be sent to a designated COVID-19 quarantine site. In the latest update to the system, authorities will suspend the health code altogether for users who have been to high-risk areas. They will only display the health code again after the user has completed quarantine and PCR tests. To ensure a visitor did not just return from a high-risk area, some shops will also ask them to present a separate journey card. The card app uses mobile phone signals to trace what cities the user had visited in the past week. Shops will sometimes deny entry to people who had just returned from high-risk areas. But the health code system is not without controversy. Nearly all provinces in China have their own health codes. There have been calls from experts to unify the system into a single national health code, but there have been no results to date. And there's been concern that some local governments have abused the health code system by using it not just for public health.
我们几个储户全部都是红码，只有这个小弟他不是我们的储户，然后他是绿码。
The most recent example is in Henan province. Victims of a suspected bank fraud were given a red health code as they arrived in the provincial capital Zhengzhou to protest and demand the return of their savings. After public outcry and media coverage, several health and public security officials were disciplined. There have also been incidents of health code systems crashing, causing severe disruptions in some cities. The central government has stressed that the health code system is strictly for public health purposes. Officials have also been saying that residents with yellow or red health codes cannot be denied entry into hospitals or their own homes. But reports of such incidents still happen from time to time. So as long as China sticks to its zero-COVID strategy, the health code is likely here to stay.